I've spent a lot of time inside hospitals myself, and this isn't just because I'm a health journalist. I've also been a caregiver to many people in my family. Both my parents have gone through various illnesses, a lot of family members have gone through difficult times, and I've been inside hospital settings. And I think it's a slightly odd thing to say, but when I'm in an hospital, I feel like I'm at home. I've been inside one so many times that I just automatically get to know the guards, the nurses, the administrators, the doctors. And very so often when it's time for me to go back, I miss that ecosystem. When you are an attendant and you're living inside a hospital space, it actually isn't a mark of death and disease. It's your only hope. It's your life. It's your home. It is the place that gives health back to those you to those you care about the most in life. And so for me, hospitals are very, very special places. And some of them I actually still, when I go back, I feel like I've come back home. This is Sonalia Charji, and you are listening to Health Wealth, a podcast that wants to help you understand health and well being without getting stressed and overwhelmed by a lot of needless facts and misinformation. If you heard our last podcast, we talked about how medical research and medicine and vaccines are really advancing at a pace we haven't seen before in our, recent living memory. But so are our hospitals. We have robotic surgeries, transplants we never thought possible, new cancer treatments, artificial intelligence, precision diagnostics. It's a very exciting time in the sector. And so much is happening that together our hospital care sector is now valued at over 11,000 billion rupees. So this is an exciting time for this industry. And I thought, why don't we have a discussion on what is there to be excited about? And what does this mean for us as patients? And what are the things that we should look forward to in 2024? So I have with me Dr. Santosh Shetty, who knows a lot about running hospitals because he is the executive director and CEO at Kokilaben Dhirubai Ambani Hospital in Bombay. Hello, Dr. Shetty. How are you?
Hello, I'm doing great, and it's a pleasure to be here today.
Fantastic. I can see you're in a hospital, and I also just got back from one. I did my annual test today, and every
A
single
good reason to be in a
a
hospital.
great reason to be in a hospital, prevention. But
Correct.
every time I'm there, it's the first thing that goes into my mind is how many people are involved in keeping the show going. We think it's just the doctors, but from your technicians to, the people who take your weight to the BP people, there's a lot that happens in an hospital ecosystem. How do you manage? How do you keep it
Like you
going?
rightly said, hospitals are very people-centric. You need at least 4 to 5 personnel per bed. So, we've got close to
Gosh.
750 beds, and we've got about 3,000 people working in this building. And like you rightly said, we only usually look at the doctor, but behind the doctor, there's a huge retinue of other support personnel, nurses, technicians, housekeeping, healthcare assistants, customer care. So the entire range. And as a patient, you may sometimes, not just be meeting the doctor, but a lot of time is spent with nursing and some of these other support staff. So it's very important for us as leaders in hospitals to make sure that each of the staff gets their due and they realize how important they are in the whole scheme of things in terms of delivering quality healthcare to the patient. So, nurses, technicians, each one has a very, very critical role to play. A simple housekeeping person, who's cleaning the rooms, cleaning the washrooms, he has a very important role to play from an infection control perspective, because a small infection can increase your length of stay by another 1 week. So each person has a very critical role to play, and it's very, very challenging because you are dealing with personnel across all strata, from the most educated to maybe not so educated. But each one has a very vital role to play. So challenge is to make sure that all of them stay motivated and driven to ensure that we provide quality healthcare.
Actually, when an aunt of mine was in hospital recently, and I went to her, and she said, my favorite person is the lady who brings my chai in the morning. Out of everyone, when I leave, she's the one, who's the most important for me. And it really, actually, for those of us who have been in hospitals, there are some faces we'll never forget in our lives. And I think the pandemic really showed this to us. So tell me, the pandemic is over. There was so much of scrutiny on hospital care, and we are now in 2024. It's, the age of AI happening. What is it like running a hospital today, in today's day, with all the technologies available and bringing that care to patients? What has changed? I mean, what is there to look forward to?
So while, like you rightly said, the pandemic was really a black swan event, but what it did was it got healthcare into the forefront. And both in the public as well as in the regulatory bodies and the governments and investors, everyone looked at healthcare suddenly as an area that needed a lot more focus on. And technology became one of the key drivers or enablers. So what COVID did was it changed behaviors. So before COVID, both patients as well as clinical professionals were reluctant to do online consults because they've said that, it's not the same thing and we may not be able to actually diagnose patients appropriately just by an online consult. But when COVID hit, suddenly there was a change in behavior. And that change in behavior has been consistent, I would say. So a lot more patients today continue to use technology. They continue to use online consults. So that's a big change which we see as far as behaviors go. We also see a lot of use of technology in diagnosis. So today a lot of patients are using wearables, they're using point of care devices, and they're able to do continuous monitoring of their vital parameters. Today you have continuous blood glucose monitors with AI built into it. So, anytime the readings go beyond a permissible limit, immediately there are alarms, there are messages which get sent across to the doctors. So we are slowly moving into an age and stage where technology is becoming a very key enabler in diagnosis. Today, if in institutions, we've got now medical technologies, like we've got total lab automation where the entire laboratory today runs on tracks with very minimal human intervention. AI is used to prioritize samples. So we know that this is an emergency sample, so this needs to go first, while a normal sample can wait. Results which are out of range get flagged and escalated. So all of those things are actually enabling diagnosis in a much quicker and a faster way. We've got things like digital PET CTs which have come in. So the whole move is towards making the whole patient experience very comfortable. So a digital PET CT, for example, you need less time to scan the patient. You need less of radiation, less of radioactive material. Quality of images are better. So physicians are able to take decisions much quicker. And there are many such examples. We have digital pathology now. What used to happen earlier was you have this image of histopathologists peering into microscopes, trying to look for those malignant cells. And today you've got digital pathology where the slides, they get scanned and, you are looking at them on a large screen, like a computer display, and AI actually points out, okay, here are some cells which are looking abnormal. So you need to focus on these cells. So the way technology is evolving, it's very, very rapid. And as institutions, we need to make sure that we kind of keep pace and make sure that our doctors and patients have access to these technologies, because these help in making diagnosis quicker and treatment better.
And if an institution were to invest in new technologies, what are some of the challenges or say the downsides of it? Because these are expensive technologies, they are fairly new. Is it easy implementing them? Like what is the roadmap like for getting a new technology to a hospital?
So like you rightly said, technologies are changing very, very rapidly. So every year you have something new that's coming in. What as institutions we need to do is, we need to, as they say, separate the wheat from the chaff, and kind of focus on technologies which are patient centric, which improve outcomes, and which are evidence based. So when you take all these criteria, and based on these, then you start evaluating technologies. A lot of technologies today focus on making the patient experience better. So if you talk of robotics in surgery, then you're talking of precision, you're talking of less bleeding, you're talking of lower probability of infections, and a shorter hospital stay. So all of these are factors which help both the institution as well as the patients. Yes, they could be expensive. And the idea is to find the right balance between patient safety, patient experience, and costs. So as institutions, you weigh some of these factors before you go in for these technologies. But number one will always be patient centricity and evidence based. I mean, based on these two criteria, then you look at commercials and see, okay, does this make sense? How do we price it at a level that it becomes accessible to most patients? Because you don't want to buy technologies which are just lying in institutions, barely used. You want to invest in technologies which get used by a large chunk of patients. And pricing and costing of services is very critical to ensure that that happens. So the whole idea will be to make it more accessible to patients.
I recently went to see a precision radiation machine. And I found that it was so fascinating how targeted it can be now. And you can actually avoid harm to a lot of non-cancerous cells as well. And in fact, oncology seems to be one area which is really evolving very fast with treatments and technology. Is there something that, say, cancer patients or, you know, those who are just interested in knowing, is there something new in oncology that might happen in 2024?
So oncology is actually, if you ask me, one of the biggest pandemics that the globe is facing at the moment. I mean, if you look at India as a country, we are adding more than 1 million cases every year. So that is the size of the problem that is there. And in oncology, there's a lot of development happening, whether it is diagnostics, where I mentioned about digital pathology, I spoke about digital PET CT. So these are tools which help in diagnosing patients, and your ability to diagnose patients earlier has a direct impact on outcomes. Cancer is a disease where if you pick up things earlier, then you can help in giving better results to patients. And one of the newer things that's coming out is circulating tumor cells, whereby with a simple blood test, you are actually able to diagnose potential cancerous cells. So they can pick up these cancerous cells much before they start invading any organ of your body. So on the diagnosis side, you have some of these tools which are coming up. On the treatment side, on the surgical side, I mentioned about robotics. Robotics is a very, very big development that has happened in cancer. There is HIFU, which is high intensity focused ultrasound for smaller tumors. So the whole goal is that how do you treat cancer in a less invasive way? If you diagnose early, you don't need a very large and extensive scarring surgery. You can treat patients in a much better way. You have things like cryotherapy coming up, where you can freeze the tumor, and you don't have to go in for extensive surgery. On the radiation side, you mentioned about these precision machines which are coming, and those are some of the latest technologies. You talk of stereotactic radiosurgery, where small tumors don't need surgery. You can simply go and take high dose radiation and get cured. You have now MR Linacs which are coming in, where patients can be treated on these radiosurgery machines with an MRI which is constantly monitoring it, so that only the cancerous tissue is treated and the surrounding tissue is completely spared. And a lot of these technologies now are focused on that. You talk of precision oncology is the next big buzzword which is there, because traditionally most patients suffering from cancer, they have a standard protocol they follow. But now with precision oncology, based on the genetic nature of the tumor, your own genetic profile, one can actually go through evidence and say, okay, this is the treatment that will work best for you. So this is where AI comes in, which kind of goes through records of millions of patients who've been treated with cancer,
Right.
and marries your profile with theirs and comes out with, okay, this is the best protocol for you. This is the best drug that will work for you. So more and more of precision oncology is coming into cancer care. So a lot of developments happening. And I always say medicine is a field where more and more engineering is coming into medicine.
No, I mean, one thing I remember, like, say, 10 years ago when I was reporting, if you went to a cancer ward, you'd hear stories of patients taking so long to recover. And today, I actually met somebody who did 45 days of radiation, and after 2 months, she was ready to travel. She was fine. So, I mean, there is definitely a lot to be said for the advancements in the treatments. Another area which, most Indians suffer from is our heart and our heart well-being. I mean, cardiovascular diseases are quite high here. We are genetically predispositioned to have more heart attacks. And I think post-COVID, it's also been in the news a lot that, very young people getting heart disease and heart failure. What's happening in our hospitals vis-a-vis looking after the heart?
So heart is obviously, the most, I would say, critical organ that one needs to focus on, because we've seen so many of these young deaths in recent times. People between the age of 30 and 40 dying, with no real past histories, or they're otherwise fit people exercising in gyms. So a lot of focus has come into cardiac. And when we talk of cardiac, obviously prevention and lifestyle management continues to be one of the critical issues that one needs to focus on. So when you talk of diet, when you talk of exercise, you talk of your lipids and cholesterol management, these are all things which have a very, very key preventive role to play as far as cardiac disease goes. Because once you are affected by coronary disease, then it's going to be a question of how do you only slow the progression of the disease. The treatments are, they still continue to be the same. I mean, you have coronary angioplasty with stents. Of course, you have newer stents which last longer and which have less chance of restenosis. You've got your cardiac bypass surgeries today. Instead of open surgeries, you do minimally invasive surgeries. But the whole goal should be focused more on prevention. Prevention continues to be a primary focus area for everybody. So we encourage more and more patients to keep their lipids in check, to follow an appropriate dietary lifestyle, to undergo periodic health checkups. Of course, if someone lands up with a cardiac issue in an emergency, then you have the full range. You talk of angiography, angioplasty, bypass, cardiac rehab programs, and ongoing lifestyle management. I think the whole concept of lifestyle medicine has become a big thing now, where patients are encouraged, even after disease or after treatments, to maintain appropriate lifestyles, and which is a combination of multiple things, both physical well-being as well as mental well-being. I think combined efforts are what is the need for the future to keep this cardiac disease under check.
You mentioned the word emergency, and that's also something which I think a lot of people might be interested in knowing is, with all this technology available, is the response rate to emergencies, particularly falls for old people or a sudden heart attack or a burns or something, very sudden and can escalate very quickly. Is technology helping improve the emergency preparedness as well?
So technology, there are obviously now apps which have come, where which are, and wearables which are able to detect falls or able to detect any abnormal cardiac rhythms, or able to detect sugar levels which are out of range, or your blood saturation, oxygen saturation level. So these are all aids which definitely help in diagnosing early. The important thing is that once diagnosed, how quickly you can reach out to medical help. Whether virtually or physically in the form of a visit to an emergency department. That still continues to be a critical piece to be worked on. So the whole emergency network and responsiveness across the country is an area that we need to work on, to focus on, to have a central network like 911 in the US. We are developing something in this country, but it's something which we need to work a lot on, so that patients have access to emergency healthcare as quickly as possible in their immediate neighborhood. Because very often patients, even in urban cities, don't know how to react to an emergency. They are scurrying, looking for phone numbers, trying to call ambulances. So how do we create a network of ambulance providers, of emergency staff, of emergency numbers, so that seamlessly patients have an access to emergency care? That's an area where some bit of work still needs to be done.
And are there any new sort of emerging areas of treatment or specialities that you see hospitals incorporating in the coming years? Something we might have not heard of.
So as as a country and as a globe, we have a lot of aging population. So geriatric medicine is an area which is coming into focus. While it's been there very much in the Western world, but in the Indian scenario, it's not really been that popular. And you see more and more senior citizens today living alone with children overseas, and they suffer from a lot of ailments, both physical and mental. And so geriatric medicine we see evolving as a very, very critical specialty going forward. Infectious diseases, they've come into prominence during COVID and post-COVID. So the whole concept and specialty of infectious medicine and infectious diseases is an area. Lifestyle medicine that I mentioned about, how do we focus a lot more on prevention? And while this, actually will prevent patients coming into a hospital, but lifestyle medicine is an area which a lot more focus needs to come into. And for a country with 1.4 billion people, where we have scarce resources as far as doctors, hospital beds go, lifestyle medicine and preventing patients coming into hospital is an area that a lot more focus and needs to come into, and it's a specialty which is coming into focus. Precision medicine, which I mentioned about briefly in my earlier part, is an area again that is coming into focus. So these are some of the key newer or emerging specialities that I would say.
And so tell me one thing that, you mentioned the word patient-centric. And so all of this is catered to, meet the needs of the patient. Do you think patients trust new technologies that easily? Because, that there is a lot of hesitation, a lot of skepticism, particularly if the prices are very high. I did a genetic testing recently and everybody thought I was mad because I spent 30,000 rupees on it. The prices are high. So how do you sort of communicate the value of that?
Pricing is definitely a huge challenge. And part of it is because these technologies are very expensive. Most of these technologies are still, coming in from European or US. And, with the rupee against the dollar or the euro, it definitely becomes very, very expensive. So important is for us to communicate the value of these technologies to patients, that if you do a genetic test and you can predict your predisposition to a particular health disease, and it can actually save you a lot more in terms of future medical expenses just by your ability to predict a particular disease and appropriate precautions that you need to take to ensure that it doesn't affect you or doesn't happen to you, or even if it does, you are able to diagnose it much more earlier. So idea will be to keep communicating with patients when newer technologies come in, the value of some of these technologies. And as institutions, the goal should be to price them in such a way that more and more patients can reach or access these technologies. But yes, pricing and newer technologies is an area that a lot more communication needs to grow across, because there is an inherent trust deficit sometimes between hospitals and patients, because patients have, they feel that, okay, just because there is a new technology, hospitals are pushing for usage of these technologies.
Yeah.
So important is to communicate the value of some of these things.
Yeah.
And then over a period of time, these become standard of care. When robotics came in, it was a novelty. I mean, patients actually thought that they were being operated by a robot, not realizing that it is actually the doctor who's doing the surgery and
And
robot
robots
is
are
only an
helping. Yeah.
enabler.
Yeah.
Correct, correct. But now today robots have become standard of care for cancer treatment.
I
So
agree.
that's how technologies continue to evolve. And once patients accept them, they become standard of care.
No, I think apart from everything else, it's awareness that plays a huge role. Getting to know what's happening, what are the new fields, what are the new technologies, and how it will benefit you. And the fact that you don't have to be in a hospital for as long as you did before. You can be up and running in 5 days after a heart failure. I've seen this happen. So thank you for sharing what you have, because I think this is a step in knowing a little bit more about what's going to happen in our hospitals this year. So thank you very much. Thank you.
A pleasure. Pleasure to be talking to you and sharing my
Thank
views.
you. So, most people equate hospitals as something bad. And I started this podcast saying I equate it with something good. Um, for me, every conversation, whether it's in a hospital setting or outside with a doctor by itself, is one of the most positive things that can ever happen, because people say doctors are very busy, they don't give you that time to explain things. But I really think that if you are consistent and interested enough, even the busiest of doctors will take out that time, will want to explain things to you, and it changes how you look at health. It changes how you look after yourself, and it really changes what all you want to invest your time and energy in. Um, what have your experiences been like in an hospital? And are you excited about the changing trends and technologies in hospital care? Do share your thoughts with us on pods@indiatoday.com or on 8588 966 And if you enjoyed this episode, please do rate us. We are available on Apple, Google, and Spotify.